The privilege of being a chiropractor is to exist in the world as one with great power in our members. We are agents of change in the lives of our patients to bring about a swift reckoning to their suffering. We are beacons of light to guide others on a path of well-being, restoring good health to millions without making a single incision. What a privilege to carry the means of healing with us wherever we go. For all we really ever need to do the work is our hands and our wits. All right, and Hompiana, how are you feeling?
Much better.
Yeah, much better. So, yeah, we're waiting for those bloods, ne?
Yeah.
Get those blood results back, and then we'll take it from there. Okay, so Mkwatla, Hompiana, how's it feeling?
A bit painful.
Where?
Just by the shoulders.
By the shoulders, hella. Okay, more than okay, it's okay. The lower back, it's fine.
Yeah.
Okay. All right, cool. So I think today we'll just do a little bit of treatment, and then we'll just focus on your shoulders, and while you're there, I'll also check for your blood results as well. Okay? Any questions for me before we start, or you're fine? Okay. All right, cool. Let's get started. Yeah, you can go get changed. The BH3 clinic, otherwise known as Broadhurst 3 Clinic, is located obviously in Broadhurst suburb. And it is a community clinic that serves the community of a catchment area of almost 28,000 patients. So we're really at the cusp of primary care, seeing a lot of those patients that are coming in with low back pain, joint pains, neck pain. And it's quite a significant burden because we're really at the cusp of a lot of patients' access. So patients come in here with a lot of these complaints. One of the big constraints we find ourselves working with here at the BH3 is that we are part of a larger ecosystem that is already heavily burdened. So at our own location here, we are, fairly busy all the time, and sometimes we need to send for blood tests at a secondary or a kind of referral center. And what you tend to find is that center itself, while it's bigger and perhaps a bit better resourced, is also fairly constrained. And so when we sometimes send patients for blood tests or for x-rays or for an ultrasound, it does also take time to get those results back. And so one of the things we have to kind of reckon with as we're referring patients in the government ecosystem is that we're waiting for long periods of time for those results, and sometimes results get lost along the way. And so we're kind of grappling with a system that's already heavily burdened and fairly under-resourced. I first came to Botswana to volunteer in 2018, and that's when I first met Shannon. We both were volunteering at the Mahalapi Hospital, and it was really cool because this was our chance to just explore what it was like being in public practice. None of us had ever worked in an interdisciplinary setting like that before, and it was really cool because I have a photo of our actual very first day in the other clinic in Shoshong. Shoshong Clinic is like 40 minutes away from the main hospital, and it was a really small village. And this was Shannon's first day, so it was pretty interesting because I didn't actually have my practicing license to practice at the time. So she was the only one seeing patients, and then I was doing her paperwork. So we became a pretty well-oiled machine. We had a really cool team working with us. So this is a photo of Kabelo and Marsha, and me and Shannon after a shift at the Shoshong Clinic. And at the end of the 3 months, we both left Botswana. And I went back to my home country, Zimbabwe. and Shannon went back to Canada to practice. So the whole 3-month period at that time, I hadn't actually had a chance to see patients because I had issues with my practicing license. And then I came back to Botswana the following year in 2019 around March, and started the process again of trying to get my license. And then on the 4th of June 2019, that's the actual first day, and I started seeing patients in the Mahalape hospital. So imagine, I've been talking to Shannon all this time, and I've been updating her about my progress, and she was back home in Canada at the time. And I remember sending her that last message to say like, hey, I finally got my practicing license, I'm seeing my first patients today. And there was only one tick it was a WhatsApp message, and there was only one tick. And it turns out that was actually the day she died. So Shannon had a brain aneurysm back home in Canada, and then she passed away crazily on the very same day that I started seeing patients here. I know she was so passionate about the space. She had plans to come back to Botswana with her family. Shannon's dad actually reached out to me, I think about 6 months after Shannon had passed, and he was talking to me about plans that him and his family and the Block family had put together to try and do something in honor of Shannon's memory. And he just asked me, what I was still doing in Botswana. And I mentioned to him that at that point, I'd left World Spine Care and I was in private practice, but I was open to do different things. And then he basically came up with a plan and idea of potentially having a clinic in Botswana in honor of Shannon's memory. And that's essentially the birth point of the Broadhurst 3 clinic. A few months later, in March 2021, we started the clinic, and it's been baby steps since then, but we've established ourselves in the city as one of the centers where people can come in and get spine care. So for all the difficult things that came to the Block family with Shannon's passing, it's definitely something beautiful that has come through in terms of being able to not just provide spine care for the people that Shannon herself had also served, but also to have something in her honor that we could all be a part of.
So I moved to Botswana in February 2023. We first came here to see how much work has to be done before we can start seeing patients. So we had to find new accommodation because we lost the previous World Spine Care accommodation due to the COVID-19 pandemic. We had to move everything out of storage into the new place. We had to buy a new car. We had to register with the Botswana Board of Medical Professionals. So it took about a month to get everything up and running before we could start seeing patients. So we have a relatively busy day today. And then we need to find some time to fit in all of these patients that haven't been booked, that don't have dates.
Yeah, maybe we can find one of the Fridays after the holidays.
World Spine Care has had clinics in Botswana for about 12 years now. They had 2 rooms in the Mahalape District Hospital and a whole clinic in Shishong. The COVID-19 pandemic hit and many of those rooms were repurposed. That's just because we didn't have volunteers here and we weren't using the space. Now in 2023, we are back, we are seeing patients, but we don't have as much space as we'd like. We have the 1 room in the hospital and it's our filing room, it's the office room and it's the treatment room. And then we have 1 room in Shishong as well. So not ideal, but we are making it work. In Mahalape, we see many geriatric patients. So a lot of the older population that have been doing hard manual labor for many years and as a result live with chronic back pain and have quite degenerative spines. Each patient gets a diagnosis and then we use the Global Spine Care Initiative's classification system We're also busy with an education program to educate the medical officers, the nurses, the guys working in orthopedics to use this classification system so that everyone is speaking the same language when it comes to diagnosing and managing lower back pain. If you look at the research that was published by the Global Burden of Disease, you'll see that low back pain is the highest cause of disability, with neck pain ranking fourth. And when working in underserved communities with patients that are doing hard manual labor, you can see that there is a huge need for treatment of these patients. And so we are hoping for more space so that we can host more volunteers from all around the world to provide better services to these patients.
When else did you see him? When else was he here? 2018? Wait, here?
2019, yeah, I came in 2019 actually. Here in Botswana, yes. Hello.
Good to see you. I'm good. How are you? Hi, Michael.
How are you?
Good to see you.
How are you doing? This is Michael.
Yeah, I hope so.
It's a fairly small space, but we make it work.
Yeah.
Yeah, like she was saying. So
You're doing it all in one room.
all in one room. Yeah, that's the only space that we had.
Yeah.
Actually, interestingly, right next door is the emergency room.
Ah.
So there's like a nebulizing
Now
unit.
you can come right here.
Yeah. So there's a lot of, like stuff happening in the clinic
Right.
right now.
Yeah.
And so obviously like one small part of it, these are our filing cabinets. So
Right.
like we're almost at 800 patients that we've seen.
Mm.
Like
Wow.
approaching 1,000.
Yeah.
And so we're just constantly thinking about
This
like,
is just from this clinic.
yeah, this is just us.
You could
Just these three clinics.
800 already.
Yeah.
I think it's quite amazing what you've done here. It's you managed to survive through a period of COVID. You managed to maintain a clinic open when there were virtually no resources, and obviously you're an important part of this clinical program.
Yeah, yeah. Yeah, I'm curious as to why we've often located ourselves in a kind of primary care center. And I wonder, when someone comes to a community clinic like this, they're not always expecting to see like a chiropractor.
Right.
But I've understood that one of the things that Worldspank has done is we've located ourselves in primary care kind of centers.
Yeah.
Why is that so important?
Well, it's important because we're dealing with chronic problems, and if a patient has to go to a tertiary or secondary care hospital or something like that, they can't make it on a regular basis. It's very hard to teach in the community. Much of what Worldspank here does, and much of the treatment protocols these days, suggest that you have to have a community-based program. And so in order to have a community-based program, you have to live in the community. And offer more than just a treatment. You have to offer an education program, a reassurance program that not every pain is serious, and you have to be available when people need you. So it is, at least we believe, it is a primary contact, primary health service that has the greatest opportunity to help people with chronic back pain and related disability.
I think one of the coolest things about working here is the idea that anyone on the street can just walk into our space and become one of our patients. There's no need for a referral, no need for like a specific kind of pathway that's difficult for patients to follow. And I imagine that was kind of maybe the idea you had when you planted the Shoshone clinic as
That's
well.
exactly right.
Yeah.
People need to have access when they have a problem.
Yeah.
And sometimes if they have an acute problem, you don't want to wait a month before they see somebody until it becomes chronic if you can relieve it earlier on.
Yeah, so I'm very glad that we can actually offer this service in this primary care
I
space.
think you've done a tremendous job. Thank you so much.
Thank you, Scott.
It's really wonderful to be back in Botswana again, see the progress that's been going on here. We started this program about 14 years ago and came on after the World global burden of disease presentation showed that back pain and neck pain were the number 1, number 4 causes of disability in the world, and yet nobody was treating it. And if we walked into the communities, which we did around the world, you found that virtually no treatment was beginning. People with back pain were not being examined properly, were not being offered any treatment. When we talked to doctors, they said they had nothing to offer. A group of us decided to start a program called World Spine Care, a non-profit, registered non-profit in both Canada and the United Kingdom. And we've now got clinics around the world. But Botswana is special. It was our very first clinic and has continued now for about 13 years, seeing patients on a continuous basis. It's really great to be here this time when Mafutsi and Michael have come together to re-establish the World Spine Care program after the COVID. And this particular clinic is kind of close to our heart, as it was the very first clinic we had, and it's now starting to get reopened again.
So the buildings are finished and the buildings are done, but they're currently doing the landscaping and all the concrete
Before they open.
before they open. So it looks like there's more work than there really is. It's really just the concrete and the landscaping, but the buildings are actually done.
Nice.
You could actually do an exercise.
So the goal is to make this last room the yoga room, because this is even bigger. After my treatment, they come in here with Cabello and they do 15 minutes of just stretching and exercises so that we're comfortable that they know how to do it,
That's right.
that they're doing it correctly. So it's almost like they're coming in for 2 treatments.
That's right.
They do the paperwork, they come in for manual therapy, and then they come in for 10 minutes of stretching so that we're comfortable that when they leave, they can do the stretches and exercises.
And doing yoga when that's excellent. Boy, this is really nice.
Yeah, it's exciting.
Yeah, it's very exciting.
I am Monkabetse Motomme, working for World Spine Care in BH3 Clinic as a healthcare assistant. I personally have been experiencing back pain since the last 5 years after my C-section. So working with Dr. Mufuzi helped me because he treated me and taught me how to exercise and keep my back strong to prevent pain. Having an income has been really amazing for me because now I can plan ahead for my future as well as my son's. And there was a moment when a patient was in for a consultation. She mentioned that her mother didn't want her to wear a certain dress but to choose a loose thing. I picked that it didn't sit well with the patient because she had scoliosis.
The Scoliosis Support Group is a safe space that patients have found to make sense of their diagnosis. It's a community that they have created amongst themselves where they can share stories and experiences to provide mental, emotional, and physical support for their journey. When you come to a clinic like the BH3, it's not the place you'd immediately expect to find a chiropractor. And yet, when you look at the significant amounts of lower back pain, neck pain, multiple joint pain that patients are coming here with, You start to wonder, why aren't there more chiropractors here? Considering how so many of these complaints are coming in at the primary care level, chiropractors are perfectly positioned with our skill set and our ability to diagnose and treat a lot of these conditions right at this level. You start to wonder, why aren't there more of us here? This is the most obvious place we need to be.
So what has your experience been working with World Spine Care?
Well, with the 7 years that I've been with World Spine Care, like I've met a lot of different doctors from different countries with different personalities, and I've learned really so much with the doctors. Basically, I was not someone who would exercise or do stretches, but with the yoga project that has been running with the World Spine Care, actually I'm the yoga teacher, lead yoga teacher. So I've learned to not to rely on painkillers, but rather do stretches first to manage my pain.
So you've been with World Spine Care pre-COVID for about 4 years.
Yes.
And now post-COVID, and you've seen how everything has changed as a result. How do you see World Spine Care moving forward? Like, what's next for our project? What do you think?
Oh well, personally, I feel we need more doctors in the clinic, and we need more space to grow. Yes, I think those are the two main things that we need for right now to grow. Yeah. Right now, most of our patients are not relying on pain relievers, but rather the exercises that are benefiting from the yoga project, and a bit of a few sessions, the doctors doing manipulation, a bit of manipulations and a bit of soft tissue therapy here and there. Yeah.
And like, for the longevity and sustainability of the project and the patients, like, we don't want to have the patients be reliant on the doctors coming. So ultimately, for the project, we want to empower the patients to stretch and strengthen and manage their own pain.
Yes.
And not be reliant on anyone else. But I'm really looking forward to working on this project together and seeing what we can accomplish with the new clinic and hopefully more volunteers to move the project forwards and help as many patients as we can. I always knew I wanted to work in public health. I feel incredibly privileged to be able to access my education as a chiropractor. I wanted the opportunity to be a part of the greater medical team to help those regardless of their economic situation and maybe the people who need it the most. In Botswana, I'm working in public health. I'm in the hospital, getting referrals from orthos and neuros, family physicians, and any medical professionals. I'm next door to the physios, the OT department, 2 halls away from the X-ray machine and the CT department. I'm a part of the system where you are just part of the greater medical team trying to make people's lives better. My hope is to welcome and help train more volunteers and expand our clinics here in Mahalape. I'm excited for the new Moko clinic.
World Spine Care has improved healthcare for tens of thousands of people, and we are proud of the work we have accomplished in Botswana over the past 14 years. I am proud of all the work that has been done outside the clinics, from scoliosis screenings and support groups, exercise and yoga programs, as well as outreach and training local healthcare professionals to better manage spinal-related disorders. My hope is that World Spine Care's vision bears significant fruit in our lifetime, which is to live in a world where everyone, regardless of income level or geographical location, has access to the best quality spine care possible.